Welcome back. For more on our top stories and others, please visit our website, channelstv.com and youtube.com/channelsweb. Log on to m.channelstv.com to watch us on your mobile device or download the Channels TV app for Android, iOS and Windows devices from the respective stores. The Channels TV and the Channels 24 apps will give you access to news and updates. You also have access to the Eyewitness feature with which you can share those pictures, videos or news of happenings around you. Just install the app, then tap and swipe to reveal the menu, and please follow the instructions. 2 hours, that's how long it will now take to diagnose tuberculosis in Ogun State. This is as a result of collaborative efforts between the federal government and the United States Agency for International Development to providing free tuberculosis treatment and preventive services to citizens. Ogun State has experienced the high burden of the disease, which is one of the reasons it was chosen for the pilot stage of the scheme out of the 2 states selected for the national flag of the project. The mobile clinic will be based in Abeokuta, the Ogun State capital, for 3 months before it will be moved to other parts of the country.
For us in Ogun State, we know that it will be in our interest to look into the well-being of our people, and that is why with affordable health care, efficient one as well, is so important to us in Ogun State. Thank you for allowing us to be the person that will showcase this wonderful initiative. Thank you that we are the forerunner of this wonderful idea. Of course, Ogun State is always known for many positive forces.
With this innovative idea, we can diagnose TB within a very short time, at most 2 hours. We can do X-ray using this vehicle. We can also diagnose the TB quickly using a genetic test. The gene expert machine is there. We will not only be able to make the diagnosis, we will also know whether the TB is a drug-resistant type or the non-drug resistant type. I'm also happy to inform Your Excellency that we will no longer have to treat our patient for 20 months. We have also introduced shorter drug regimen that will enable our people to comply with the treatment.
And Dr. Babatunde Ikpare, the Commissioner for Health, Ogun State, joins me in the studio now to talk more about this issue. Very welcome.
Thank you. Good afternoon.
All right. So what are the statistics? I mean, how did Ogun State end up as #1 in the WOW efforts at treating and detecting tuberculosis?
Okay. Good afternoon, viewers. There are 2 reasons why Ogun State was picked. The first is that health is one of the priority agenda of the Bikola Amoso-led administration. The governor, when campaigning in 2011, had made affordable and qualitative health the second of his 5 cardinal development agenda on the mission to rebuild Ogun State. And Ogun State has come out tops in many of the indicators in terms of system performance. Very recently, the Federal Ministry of Health and WHO awarded Ogun State the best state in Nigeria in terms of disease surveillance and response. And so, if you want a response to be fast anywhere in Nigeria, the best state to start is Ogun State. That's one. 2 is that we've developed a system that could actually, you could plug in and play. Okay, if you recall, before His Excellency became the governor, Ogun State was like number 35, 36 in the ease of doing business in Nigeria. And in 2-3 years of his administration, Ogun State became one of the best 4 states in Nigeria to do business. And public health is serious business. If you look at statistics in Nigeria, about 600,000 people, contact tuberculosis on an annual basis. And of the 600,000, only 100,000 plus is able to be diagnosed. And that represents about 17% case detection rate. It means that 83% of those who have tuberculosis annually in Nigeria are not detected. And if you come down to Ogun State, we have an annual average incidence of about 16,700 people, and only about 2,551 of these are picked. Recall that in Ogun State, we've got about 251 treatment centers. We also have about 54 diagnostic centers, but there's a major barrier. The major barrier is that people don't have access, particularly those who live in hard-to-reach areas. And we, as a state, we are committed to taking care of the poor and the vulnerables, particularly those who live far from health facilities. So when system audit was done, and they felt like if you need to do this quickly and fast, Ogun State should pioneer this.
And you think that these mobile clinics will be able to get to the nook and cranny of the the state?
Because we have done several interventions in the state, I have gotten to nooks and crannies. Ogun State is leading other states in Nigeria in terms of social health insurance scheme called Araya. I'm sure you must have heard about Araya. And the whole purpose of Araya is driving health system into the communities where people don't ordinarily get to, where poor, indigent people are able to access services because government prepay. About 16,000 people are on government Araya program.
Do you foresee any challenges for this initiative?
No, not at all. First reason is that we have mobilized our community stakeholders. Because it's arrogant for a system to say you deliver health to the people. The health of the people is actually their responsibility. Our job is to mobilize them to take full care of that responsibility. We also have mobilized our medical officers of health in the 20 local government and the 37 SCDs. So what we are doing is just providing a mobile outfit, just like a clinic, that has digital X-ray, has got 2 gene expert machines, and so 2 major barriers to accessing care will be taken care of simultaneously. The first is barrier due to geography, and the second is barrier due to cost, because this is coming to people for free. And so as many people as we are able to pick in any community will be diagnosed within 2 minutes of digital X-ray for free, or within 2 hours of the gene expert machine for free. And this machine has capacity to, diagnose about 500 cases in a day. And so, for the next 3 months, the plan is to move from one local government to another, one community to another, one local government development area to another. Particularly, the governor committed that start from my local government because TB is everywhere. It doesn't discriminate whether you are rich, poor, whether you are. So
what can people expect when we say mobile clinic, for especially those listening now? What can they expect from a mobile clinic?
You just expect that you wake up one day and services will be brought to your doorstep. We've got a calendar of movement, and then, like I told you, we have 57 locations to go to in Ogun State, 30 local government and 20 local government areas, and 37 local government development areas. And we'll be spending an average about 1 week in each location. So this vehicle, we drop a plan. The plan will be communicated to the people when they come. We have our community stakeholders, those who help mobilize people. Because in every local government in Ogun State, we've got what we call the CDC. In every local government in Ogun State, we've got, the community health associations.
And I take it a lot of sensitization is going on.
Yeah,
with
definitely.
All of this
because there's a platform to do that ordinarily.
Let me ask this question finally. In 2010, there was something someone wrote, Mr. Bole Ajayoba, something on traditional management of tuberculosis in Ogun State. Is this perhaps, something that, would lead to anything good for Nigeria in the long term? Traditional methods of solving?
Well, there are a lot of conceptual framework about how to manage tuberculosis using traditional approach. They remain in the realm of conceptual framework. Science has gone beyond, trying things. If you listen to the Honorable Minister, the science has gone beyond treating tuberculosis. You remember in years past, TB patients are usually isolated in a position called sanatorium in one distant hospital. But science has gone beyond that. Yes, this disease is communicable, okay, but it is treatable and curable. And the science has brought out, medications that can actually cure, uncomplicated tuberculosis within the first 6 months. And so what patients need to do is to have an early diagnosis and then apply the medication as prescribed, right? 6 months, the treatment is gone. So why do you want to try something that is not scientifically proven?
Okay.
Even for the multi-drug resistant tuberculosis, patient to be on treatment for about a year now, not 2 years anymore, and the patient is cured. And the cure rate is 100% for those who have 95% adherence to their medications.
All right, we'd like to thank you so much, Dr. Babatunde Kwaye, Commissioner for Health, Ogun State, for coming on the program.
Thank you for thanking me.
Well, please stay with us, because when we return, we hear from pensioners in Delta State and the latest on their welfare. Please stay with us.